I consider the nationwide launching of the e-health project as one of the strategic pillars of the health sector reforms in Ghana. My assertion in this respect stems from the fact that over the last 3 decades, which obviously requires that we are doing things differently by embracing modern, innovative ways of health system strengthening. Moreover, using health information systems to strengthen health delivery is one communicate with each other. This is especially so in hospitals where diagnostic systems have no direct link with other service delivery sectors like medical records, pharmacy, and other supporting services. Mr. Chairman, distinguished ladies and gentlemen, it is noteworthy that the net effect of the aforementioned concerns is that control systems do not exist, and performance statistics contain too many gaps to make them realistic. Service coverage data, therefore, are only reliable through surveys and which are relatively expensive. E-health, therefore, holds a lot of promise in helping countries like Ghana to make strides that are urgently needed for improving the health of our communities, especially those in the rural and the hard-to-reach areas. It is therefore noteworthy that the government of Ghana Information and Communication Technology Policy, its ICT for Accelerated Development, states, among others, that ICT will be utilized to promote national development. The National E-Health Policy Strategy, therefore, provides a framework for engaging consumers of health service and others. It is noteworthy that this is what the Ministry of Health and Ghana Health Service want to use to give health for all the people in this country. The launching of lightwave e-health systems, which is supporting 26 health facilities, ranging from primary health care centers to teaching hospitals, to deploy health information systems. Close to about 70 faith-based, that's Church health institutions, are also supported by Infotech to deploy hospital administration management system, HAMS. In addition, the ministry has also procured digital X-rays and automated laboratory analyzers, which has been distributed throughout the country. So anybody can take an X-ray somewhere and it will be read and interpreted by radiologists at a faraway place. A similar approach has also been used in early infant diagnosis for HIV/AIDS. For example, we are using what we call DBS, the dry blood samples, where laboratory tests are taken for HIV mothers, and they are sent to the laboratories, and the results sent to the midwife at any place by using a WhatsApp or a text message. The health sector in Ghana has also been leveraging telemedicine to facilitate access to health care and improve referrals. I'll give you a few examples. For example, the Millennium Village Project, MVP in Ghana, piloted telemedicine in Amansia West. They created a teleconsultation center in Kumasi, and we have trained nurses, midwives, and doctors who give teleconsultation to people in the remote areas without the patient moving to the health hospital. The climate change and health project funded by UNDP in Ghana has also supported similar telemedicine projects in Keita District Hospital in the Volta region. In the same way, the Ghana Health Service has also deployed the DHIS2 e-tracker to help register all pregnant women, children, and HIV and TB patients to ensure that they are not left out of receiving scheduled care. The adolescent health program in Ghana, and for that matter in Ghana Health Service, is taking advantage of the social media in this country. They are using, the adolescents are using a Facebook page with interactive contents to engage the adolescents. They also have developed mobile applications which can be downloaded from the Google Play and Play Store, and it's called GHSYMK. Through this, a young lady who is getting to a menstruation will learn all about menstruation, will learn about sex education, and they also will learn what to do and what not to do when you are in adolescent stage. We are also using what we call the M-Health subcomponent of e-health, which is extensively to support the community service delivery using, first, digital assistance and epi surveyor, which have been used for some time. We're also using what we call the MOTEC registered or pregnant women so that they are not left out to go to antenatal care. The Millennium Village project in Amansia West has also deployed mobile phones for community health workers for use for service delivery, surveillance, and reporting using the home care applications. So what Dr. Siedu Queen said, we will not only depend on the hospital facility records that we get, but community health workers who are assisting community health nurses can have real-time data which will be sent onto the DIM system, and then we can detect any disease at any time. Mr. Chairman, I will say that this would, however, be the need to also strengthen our legal and policy environment, which we need to implement such advances in e-health to ensure that this country fully benefits from the e-health project. Ghana, like most countries in the sub-region, continues to experience epidemic outbreaks. The main problem is that while a disease surveillance system exists, as Dr. Siedu Bekwin said, the service does not have reliable early warning systems. And therefore, capturing outbreaks at the early stages is a problem. Thus, the threshold for responding for epidemic diseases are only noted when the epidemic has already taken place. To respond to these challenges, we must, as a matter of urgency, modernize our infrastructure and healthcare delivery through widespread adoption of electronic health records, such as the one being launched here, that will generate enough data to change the practice of medicine. I therefore consider the launching of this as very timely in view of the multiple benefits which has already been shown that the health service stands to obtain from the e-health systems of health strengthening. Honorable Chief of Staff, Honorable Minister, from the aforementioned exposition of e-health, I'm of a firm belief that the health sector needs to take advantage of these developments as quickly as possible and make benefits available to the patients. Clinicians also stand to benefit because in order to make evidence-based decisions, they need high-quality data obtained from multiple sources, such as inpatient, outpatient care, acute and chronic settings, urban and rural care, and populations at risk. This can only be accompanied with electronic health records and discrete structured data. Distinguished ladies and gentlemen, healthcare data needs to be combined or aggregated to achieve statistical significance. It is, however, quite worrying that most of our primary healthcare centers is delivered by small facilities such as CHIPs, compounds, and clinics with relatively small patient population, thus making aggregation of data necessary. However, for the large healthcare organization or facilities, there is also a large number of data generated from widespread electronic health records, which requires a new data analytic tools. I wish also to inform you that the folder system is currently in use in the service, which lacks the ability to integrate with other printed forms of information. The ability to integrate health records with a variety of other services and information to share the information is therefore critical in the future of the healthcare reform. I'm delighted, therefore, that the digital, unlike the paper-based healthcare information system, can be integrated with multiple internal and external applications that will make sharing of health information possible, and it can integrate with analytic software for data mining. I'm reliably informed that the e-health project comes with enhanced physical infrastructure facilities to enable the Center for Health Information Management and the Disease Surveillance Unit of the service come together to perform its comprehensive surveillance function for the country. Moreover, as it is designed, it forms the basis for the establishment of a Center for Disease Control, which can be further developed as a training center in the future. So, Honorable Chief of Staff, what Ghana Health Service is saying is that as a matter of urgency, we should use this as a base to establish Ghana Center for Disease Control, which we can use for the sub-region. It will bring direct foreign exchange, and it can also be a system that we can use to do surveillance for the whole sub-region. And this, we hope, by the second quarter of this year, will be possible. There are several areas where the service expects improvements, especially with respect to patient safety, Notable among the areas are improved legibility of clinical notes, improved access anytime and anywhere, but of course, under strict protocols, reduced duplication, reminders that tests or preventive services are overdue, clinical decision support that reminds clinicians about patient allergies, correct doses of drugs, to mention but a few. It is therefore gladdens my heart that with the launching of the e-health project, all this information will be available at a glance and will save time and resources to improve claims management and enhance conditions of service. We want to have zero tolerance for claims rejection, and this will help us. Honorable Ministers, Honorable Chief of Staff, distinguished invited guests, in bringing my statement on this occasion to a close, I wish to assure you that as a service, we are poised to adopt the e-health project to partly address the current operational challenges which confront data management at all levels of service. The Ghana Health Service is indeed glad to be part of this innovation and transformation, since e-health has the potential strengthening of our weak health system to make our more adaptable to meet the needs of the country. And I believe with e-health introduced in this country, we can achieve, and I qualified it, we can achieve quality universal health coverage for all Ghanaians by the year 2030.
The vision of e-health is well captured in the MPP manifesto. And so it is just a matter of time for the full potential of that promise to be delivered. On page 118 of the manifesto, the President and those of us following him assured Ghanaians that we will utilize the best of technology and health insurance management protocols to tackle waste, corruption, and insurance claim fraud under the National Health Insurance Scheme. This, we said, will include completely phasing out the manual processing of claims, which currently stands at about 90%. Tightly linking services and drugs to hospital attendance and treatment to diagnosis. Today, we are about to make this promise a reality based on experiences and lessons gathered through extensive engagements during the first phase of this project. The prospect of sharing patient information electronically with other healthcare providers within a safe environment is critical to measures aimed at improving patient safety and quality of care. Many of our doctors now hold accurate and comprehensive information about their patients that has been progressively built up over time. But unfortunately, these are held in folders that are currently stored in cardboard boxes and sometimes on corridors of our health facilities. In this day and age, when third-party involvement in healthcare delivery is creating serious legal demands on us, we need to strike a balance between clinical safety and consumer expectations and patient rights standards that are difficult to accommodate under the current manual system. The introduction of electronic health records, a key design feature of the system we are about to launch, provides an easy-to-use interface for doctors and other health workers to undertake their time-honored clinical and other patient management calls, like history taking, performing medical examination, assessing information, and requesting investigations if needed, then making diagnosis and deciding on treatment plans. The beauty of it is that all these pieces of information are stored electronically and can be accessed and shared through the electronic health records. Indeed, the National E-Health Project, at the most basic level, will enable doctors to assess pathology results, diagnostic imaging results, discharge summaries, and current medications and adverse events on each patient from electronic health records. This is basic information, yet critical to patient care. Honorable Chief of Staff, distinguished ladies and gentlemen, again on page 120 of the same manifesto, we stated that we will implement a national epidemic response system. The National E-Health Project will also help us anticipate epidemics and accelerate nationwide identification of infectious threats to avoid infectious outbreaks as a complement to existing tools. And I think we have seen a demonstration that will convince my friend and colleague, WR, the World Health Representative, that we are working on health security and safety and emergency responses are all things that we are seriously working on. And the document you are requesting from us will soon land on your desk. Again, this is another promise we are taking steps to fulfill today. So the president is not doing free school and restoration of allowances, but e-health and other technologically designed interventions that will move us faster and give us quality data to help our doctors provide the quality health care we are looking for. Distinguished ladies and gentlemen, digital technology is now an established feature of modern society. And Ghana, under this administration, will want to be at the forefront in creating the right conditions for allowing digital developments to flourish, especially in the health sector. Distinguished ladies and gentlemen, the challenge of universal health coverage is such that the solution does not lie in massive investments in hospitals and clinics alone. We need to apply technology to boost coverage of our public health systems and to empower our populations to seek treatment and make healthier lifestyle choices. We need to leverage technology in our search for solutions in the management of diseases of poverty and other neglected diseases. Above all, we need to apply technology to bridge the persistent human resource gap through concepts like telemedicine and mobile consultations. The deployment of technology in the health sector will only be worthwhile if it can help us to bring better health to more people at a cost that we can afford and sustain. But, distinguished ladies and gentlemen, the improved efficiency we have observed in the first phase of implementation through improvements in both management and technical efficiency of the health workforce at all levels through reliable information dissemination systems and by supporting the decision-making process is worth any serious investments in this area of healthcare. I will therefore use the opportunity to emphasize the need for systematic cost-benefit analysis, impact assessment, and the performance measurement to ensure sustainability, a demand-driven approach, less fragmentation, and full compliance with international and national standardization and interoperability. Honorable Chief of Staff, invited guests, ladies and gentlemen, Nananum, let me end by reiterating that the right approach and the right information and the right investment in e-health can deliver real benefits to patient care and to the efficiency of the healthcare system of this country. And I'll use the opportunity to ask us all to get behind this project and make it the reality that the Ghanaian health system needs. Let me look at one or two challenges that Dr. Pratt, the medical director of the hospital mentioned. Accommodation and re-equipping the hospital to play its proper role. The Director General is talking about CDC, and I believe he, together with us, will know how seriously we are working on that. And I suspect that is what gave him the boldness to give a deadline of second quarter next year. We are working in that area. Not only that, by close of next year, we are looking at the introduction of a bioequivalence center in our country as well. Dr. Pra, you will agree with me that this president didn't inherit gold. He looks like he's one of the very unlucky presidents we have had in our time. All the challenges that you threw out have been captured in our planning. And much as we're looking for money to do some of these things, some other issues have become more paramount. And we are now looking at how best we can make our health insurance system, which impacts so much on revenues that you generate to run your facility, so much, than even getting us invest immediately into accommodation. We are working on these things. But I want to assure you that not until we clear some significant portion of the arrears that the health insurance owes providers, we are working on that. You have seen some, how do I call it, signs of health insurance beginning to crawl and walking and running again by close of next year. Let us tackle our challenges systematically, and I believe some of these problems will be a matter of the past when we have solved one major big problem that will give confidence to our people to even attend your facilities. The Director General mentioned about the efforts we have made so far in trying to retool, re-equip facilities that we have in our country. That process is ongoing. And God willing, maybe even this week, we will announce the distribution of a number of anesthesia equipment that will be distributed to the hospitals that do not even have this. We've got them already in the system. For early detection, Dr. Bequin was hammering on early detection, early detection. Those of us who are laymen in medicine, all we know is that when you are ill and you go to hospital very quickly, you get your problem solved by the doctors. But if you sit home for 2 weeks, even when you go, they insult you. What were you doing all that time? So early detection is something that is very, very, very necessary, not for detecting diseases very, very quickly, realign, but doing everything that we have to do very, very quickly and early is something that will help us provide the care that our people need. Nananom and Honorable Chief of Staff, I think I'll end here. I want to thank you so much for attending this function to help us launch what we call the surveillance module of the package that we are running to help do healthcare in our country.